Make it today. It's an honor to be a part of Weavy and be a sponsor for you guys. I've gotten to meet a lot of super awesome people, and it's a pleasure to meet all of you tonight. So I've probably met some of you before, but it's great to meet the rest of you. Like Sue said, I'm Todd Rodman. I'm a sports medicine chiropractor, which is a little different than most chiropractors. It means that I'm board certified as a sports chiropractor, almost like a non-surgical orthopedic. Our medicine is like our hands and the therapies that we use. We have a lot of different stuff that helps people to overcome an injury as fast as possible, or just to perform your best and feel really good. So tonight, Sue asked me to talk about foam rolling and why it's important. So I call this Get Your Roll On. And if you, most of you probably have a foam roller at home. I would imagine you do. You got to dust it off, some people. It's okay, I understand. I have the same problem. Foam rolling is super important, and I use that as a kind of overall blanket word, because foam rolling is really something, it's more like myofascial release, which just basically means you're working on like super tight, overused muscles. Whatever you do most in life, you have to try to do the opposite position as much as possible, or unravel those tight muscles that you're using all the time. So a foam roller is a great way to do that. So tonight I'm going to hopefully teach you guys some great things and some tricks that you can do on your own to help perform better and help prevent yourself from having to see a guy like me, although I'd love to see if you ever need anything. Okay, so let's start with 20 to 40 per day. Basically, a lot of people say that everybody should be doing at least 20 minutes of mobility a day. And mobility can be stretching, can be foam rolling, can be using band works, basically trying to unravel that tightness that we develop from life, from gravity, from posture, from doing things a lot. So I know it sounds overwhelming and a lot. I say chip away. And if you're active, you're supposed to be doing 40 minutes a day. So I fit it in the weirdest places. Like, we'll talk about it in a little bit, but if you ever see me like driving in my car, I have like a lacrosse ball on my back, and I'm like rubbing it. I'm working on my mid-back while I'm driving, still paying attention to the road if I can. But there's always something you can do. So we'll try to give you guys some ideas, and maybe something will hit home. Maybe you have a specific injury going on right now. Maybe I'll uncover that. If not, then you can come up to me personally, ask me a question. Maybe I'll give you the best way you can attack that on your own. So why does rolling work? Okay, so pressure on the muscle releases tension. That's why massage has been around forever, because it works. It's time tested, it's proven. Pressure on the muscle resets the muscle. So foam rolling is just a way to locate, detect, and destroy those tight muscles that we have. So I actually talk about foam rolling as kind of makes the invisible visible. Basically, like, you don't always feel pain unless you have inflammation. But tightness is actually the real problem there. You want to unravel these tightnesses. So if you go to the dentist, you didn't always know your teeth hurt until he or she takes that little tool and they scrape around and you feel that sensitivity. A lot of patients say to me, like, I didn't know I had pain there until you pushed on it. So we don't push on our muscles every day and know a problem's there. We just feel a little stiff in the morning. We get used to it. It's our normal stiffness, gets better throughout the day. That's the real injury. If you have that going on, you need to address and try to locate and attack those tight spots. So a foam roller is a great way to make the invisible visible, to scan and to find these little balls of tightness that we have and get rid of them. So basically, how do you use a foam roller? A lot of people know. You're rolling out pizza dough. You're basically trying to locate a tight spot. If a muscle's lumpy and bumpy, that's wrong. If something is sore to push, no muscle in our body should ever be sore to touch. If it is sore, maybe if you just went for a run, you got lactic acid buildup, you can have kind of soreness from a workout. But if something's lumpy, bumpy, really tender, compare it to the other side. If it's not on that other side, it means that there's probably a tightness on that side that needs to be rolled out. So yeah, you can roll. You don't have to roll though. The foam rolling name kind of makes it sound like you have to roll. But you can just put pressure on there. Like, I just like to get as much pressure as I can and hold it until that muscle releases. A lot of people ask me, how long do you foam roll for? I say, generally 5 minutes on a spot will do the trick. But if the spot is tender or tight, you want to hold pressure on there, and you'll actually feel like that knot, that lumpy bumpy kind of melts a little bit, or that soreness goes away. That means time to move on to the next spot. So that's just pressure. Also, my favorite way is to pressure and then torque. So like if you take a foam roller and you kind of really, you get on it, and then like I hold down the muscle and I'll rotate on there. Torque generates a lot of force. So if you find that lumpy, bumpy spot, that soreness, you get in there, and then you're gonna twist and rotate on that spot. That's another technique. So those are your 3 ways to get it. Just pressure, don't make it rocket science, it's so easy. Pressure, roll, or torque. Whatever you wanna do, whatever you feel best. I say put a pillow under your head, watch some TV, forget you're even doing it, and then all of a sudden you're like, wow, that spot's a lot better. Really all you need, you know, at the end of the day is 5 minutes on each muscle. It's usually the best amount of time. One rule I tell people, if it radiates, get off that spot. If it's sharp shooting pain, if you get numbness, tingling, you're probably on a nerve. Nerves don't like to be pushed on, so stay away from there. IT band, I figured this was a good thing to talk about tonight. And I'm sorry I'm throwing a lot of stuff at you real quick. I can always readdress it if you ever want to talk individually, but I'm trying to keep it compact. IT band, a lot of people don't quite know where it comes from sometimes, and most of the time the IT band actually, you know, if you look at it on an anatomy chart, it's like a huge thick cable. It doesn't stretch at all really. You know, when you do foam rolling, you actually, the tendons do not get softer and supple. They actually just kind of stay their same length. They do not stretch. They're like big, long cables. So the IT band, which is this big, thick tendon that runs down your leg from the ilium to the tibia, which is the IT, actually is a merger of this muscle here on the side of the hip, the tensor fascial lata, and your butt, your glute maximus. They come together and they go down your leg. So whenever you're foam rolling, whenever you're choosing to do to get on these muscles, you want to work on not the tendon, but the muscle itself. So the problem usually comes from here. A lot of people like to foam roll on their IT band because it feels good. I mean, anytime you foam roll, there's a little pain. Anytime you have a little pain, it releases some endorphins, as you guys know with running, and it feels kind of good. So you'll feel better, but the IT band, it will keep coming back if you don't address the muscle belly. Tendons don't really respond to foam rolling very well. Also, if you're going to foam roll your IT band, watch out for this bone right here. If you guys all can feel the side of your hip, there's a big bone. Anyone know what that bone is called? Hip? That's a good guess. It is the hip. You got it. It's the greater trochanter, right? So watch out for the greater trochanter. If you foam roll that bone, you're going to get yourself bursitis. Bursitis is inflammation of the bursa. Bursas are like these fluid-filled sacs, so there's no friction when the muscles rub on each other. So stay away from there. One thing I see is people try to help themselves, they end up hurting themselves when they foam roll that bone, so stay away from there. We're going to move on. I kind of want to gear this towards running, obviously. So does anyone know the most common reason for running injuries? Any wild guess?
Overuse.
Too quick.
Overuse is the answer. Too quick, that's cool. I like that. It's actually
not me.
Not you.
I just say too quickly. Like,
Yeah.
Trying to move too fast.
Absolutely.
Yeah.
Any sport, if you progress past your abilities, you're gonna probably get a little injury. That's true. But overuse really, and overuse. If you break down running, the sport of running is, you probably heard this before, but it's the constant act of falling. You know, if you look at it in slow motion, it's falling on one leg and balancing on one leg. How good is your one-legged balance? If it's not symmetrical and perfect, and you maybe have a knee that comes in or out, and you do that thousands and thousands of times, even in one run, you're gonna have an overuse injury. So the main injury that I tell people is medial knee deviation. Their knee comes in, and if you ever watch some people on slow motion, you guys should, you know, videotape yourselves. There's so much slow motion apps now. See if your knee comes in, if your foot comes in. You do that, you know, if you break down a mile, it's what, like 5,280 feet. It's been a while since I had that class, but you know, average stride length maybe 2 or 3 feet. That's 2,000 steps each mile. If you're falling with that knee in, you're setting yourself up for an injury. And that same mechanism of injury, the knee coming in, is why we get plantar fasciitis, why we get heel spurs, why we get Achilles tendonitis, shin splints, knee pain, meniscus pain, IT band issues, glute and lower back issues. It's all the same problem. So you want to really make sure, if I drive home one thing tonight, It's really making sure that your one-legged balance is perfect. And that happens a lot of times, obviously, through great coaching. Some people just need to be educated or build that motor communication in their body of how to do it properly. But some people's muscles are so tight it pulls in that way. So it's either a motor issue or a tissue issue. Maybe the muscle's too tight. So that's what the foam rolling can address. The coach can address the proper motor skills to not have that knee come in. There's two main reasons for that knee coming in. And the first one is every runner knows is like overpronation. You probably have heard of it so many times, you probably can teach me about it, but if you don't know what it is, it's basically your foot is rolling in too far. Your arch has kind of lost its elasticity and you're kind of getting in flat, and there comes the knee with it, and there comes the hip. And if you feel that bone, which you guys now know, the greater trochanter, when you turn your foot in, you feel how much that moves. Your foot guides your hip. It guides where your low back is. If your foot's coming in, your hip's coming